Welcome back to the Chad Hasty Show, News Talk 95.1 FM and 790 AM KFYO. Joining us on the phones this morning, you've seen him on different Fox Business and quite a few other places as well. Jim Frogue, he's a partner and co-founder of Frogue Clark, nationally recognized health policy expert. During the 2016 election cycle, Jim was senior health policy advisor to the Trump for President campaign. Jim, welcome to the show today. How are you?
Good morning, Chad. Doing great. How are you?
Doing great. Appreciate you joining us today. Obviously, healthcare is one of these topics that we're hearing a lot about going into the 2020 election. The president has teased that he wants to address some issues with the healthcare industry, and the Democrats obviously keep on coming out and saying they want to give everybody free healthcare. Whether you're in this country legally or not. Jim, when we take a look back to the last week and the last two debates that the Democrats had, what did you take away from their ideas when it comes to health care in this country?
Well, they want the government to be in charge. And they simply, the only difference between them is the pace at which they want to get there. Bernie Sanders and Elizabeth Warren have been very clear. We'd be happy to get rid of everyone's private health insurance tomorrow. The rest want to move a little more slowly. There's one Democrat, though, named John Delaney, who wrote an op-ed a few weeks ago where said what they're trying to do is political suicide. He's right, but the rest of them aren't listening to him.
Well, and okay, let's say that one of these Democrats who, they want to get rid of private insurance, they want to go to, I guess they call it Medicare for all. What would that do to health care in this nation?
Well, it would be very disruptive. The Medicare system has been around since 1965. It's mostly pretty popular, but it's also going bankrupt. And adding a lot more people to it will involve very significant tax increases and very reduced access to care. So it's just not the right solution. It's not the path forward. Ironically, the most popular piece of the Medicare program is called Medicare Advantage, and some of your older listeners may be in Medicare Advantage programs. About 22 million seniors are in Medicare Advantage. That is private plans in Medicare. It's very popular with Medicare. More people are trying to get in it than get out of it. And Democrats are going to have to answer about whether or not they're going to get rid of Medicare Advantage, because it's the one piece of Medicare that's working well, that's popular with seniors, and it's very comprehensive coverage, but it's private plans doing it. And that's a Republican initiative that's almost 15 years old now. Republicans should do a better job taking credit for the successes they've had in healthcare.
Well, and what do you think? What changes do need to be made? You hear the president talking about this, and obviously in your role in 2016, you had a lot of conversations with President Trump about the future of healthcare in America. What do you think needs to be done, if anything, in as far as healthcare goes?
Well, most simply, the more choice you have, the more powerful you are.
Yeah.
That's what it really comes down to, and that's a 70,000-foot comment. But basically, if you have the ability to move among plans, you have power. If you think of Medicare for all in the Bernie Sanders version, there's one plan. It's run by the government, and if you don't like it as a patient or a doctor or a hospital, you have nowhere else to go. That's exactly the opposite of having choice and having power. So no Republican is going to defend the insurance industry all the time. Sometimes it does bad things. Sometimes insurance companies aren't real responsive and they don't pay what they're supposed to pay. But you're powerful if you have choice. And the more choice you have, the better off you're going to be. And that's what the president's been pursuing, and the Democrats are trying to move in the opposite direction. And if the Democrats really want to go down this road of Medicare for all or single payer or government-run health care, whatever you want to call it, it's going to be real trouble, because most Americans, once they really start looking at it, especially when the tax increases are known, they're just going to run the other direction.
Well, and that's something, Jim, that when some of these moderators or journalists, they ask Bernie Sanders, he doesn't want to come out and just say it. They kind of have to pry a little bit, but even he admits, middle-class taxes, everybody's taxes are going to go up. If his plan ever comes to fruition, taxes have to go up. They have to go up for everybody. And, Jim, what does it also tell you that when you see some of these polling numbers that come out, that initially, yeah, people love the idea of, quote unquote, free health care, but 60% of people don't want to give up their private insurance. They think that that's a terrible thing to do. What does that tell you?
Well, people aren't fans of tax increases, and you can just ask President Mondale about that. When he went out and advocated strongly for tax increases, he lost in a 49-state landslide.
Yeah.
Most people are pretty happy with their own health care, most people, most of the time. But they generally recognize there's some gaps in the system that need to be filled. So most people, the way Hillary Care back in 93, 94, if you remember that big fight, the way the Republicans were able to turn it back was say, she's going to take away what you have now. And that's what just completely undercut support for Hillary Care back in 93, 94. People like what they have, and if it's going to be taken away, they are going to not be happy about it. 180 million Americans are in private health insurance. Most of them, most of the time, are pretty happy. So the Democrats got to think real hard about the political realities of their ideas. Visiting
with Jim Frogue, Frogue Clark. Before I let you go, Jim, this idea that was really not swatted down by any of the Democrats, I don't believe, on the debate stage, that even those who get to the United States illegally and are here illegally, that they would be given free health, quote unquote, free health care. That's not a very popular measure by any means with the American people. The more that Democrats embrace this and talk about this idea and talk about raising taxes, do you believe that this is a pathway to victory for the Republicans, the more that Democrats talk about this?
Yeah, I think 1972 is a good analogy. I think the Democrats moved so far left. Nixon's poll numbers were never super high, but the Democrats just moved so far left, Nixon became the obvious choice, and he won in a landslide. Right now, the Democrats are very likely to nominate. If I had to bet, Chad, if you and I had a bet, I would take either Elizabeth Warren or Kamala Harris as the Democratic nominee. You could have the field. We'd make it an even money bet. And those two are both very far to the left, and it's going to be extraordinarily hard for them to win a majority of Americans.
Yeah, no, I'm with you on that. Jim Frogue, appreciate your time today, and enjoy your Independence Day weekend, and I'm sure we'll visit again as this campaign 2020 continues.
Absolutely. Happy 4th to you and your listeners.
Thank you. Appreciate it. That's Jim Frogue with Frogue Clark here on the Chad Hasty Show. He was Senior Health Policy Advisor to the Trump for President campaign back in 2016. Chad Hasty Show, KFYO.